Hi, I'm Jason Posner from Boca Raton, Florida, and I'm here with two world-renowned experts on No Spin Live. We have Dr. Christy Ustak from Houston, Texas. I was going to say
Houston, Florida. Hey,
Texas.
yeah.
Right? Well, we got the two states that have the space programs, right?
There you go.
Right, but in the real almost space program area, we have Armando Soto from Orlando. How far are you from the NASA area there?
About 45 minutes.
Yeah, it's pretty cool there. I went there once, and I went to the the museum there, and they have like an Apollo rocket on the ceiling, and
it's cool.
You can't believe it until you actually see it. It goes like 5 football fields long.
Speaking of space, I just saw this back there. I'm going to space. This is a picture of me and one of my best girlfriends who is a pilot, a NASA pilot.
Oh, wow.
And so she had that scanned, so she's going to take it up in her stuff when she goes up to the space station.
Oh,
so I've been telling everybody, I'm going to space. I'm just not paying for it.
Tell her to like get a picture of her holding the picture with you and the Earth in the
background.
Totally,
and be like, yeah, I went to space.
Cool. Yeah. Well, maybe what we could do is,
yeah.
They do have some space backgrounds on Zoom here. You can put that on the next time.
Good thinking. All right, you got it.
You're gonna say Christy from space.
From space,
yeah. Do I have a space background? I don't know. I don't have a space back. Oh yeah, look.
Hey, space theme.
All right.
That was a quick trip.
That's a quick trip, right? Okay, so I'm gonna do the rest of this in space. All right, so we have two topics today that are really actually kind of similar. And the first one is finally not a BBL bashing article. It's actually on an article about the rise of BBL. Obviously, we're in Florida. We get asked a lot about this, and Texas, I'm sure you get quite a bit of this. So,
definitely.
Why don't you lead off, Armando, and tell us about the rise of buttock fat grafting?
Well, I really connect it to the rise of celebrity culture, in internet media and social media. And when I think of the rise in popularity of BBL surgery, I really think of three people, right? Beyonce, J-Lo, and Kim Kardashian, right? And they all, right? They all kind of came up at the same time, and they all, Beyonce's a great singer and a great entertainer, and J-Lo is as well. But, the size of their butts and the shape of their butts really was tied into their celebrity, and that really kind of developed an interest in the surgery. And when I think the operation started to become popular and people started to want that aesthetic, I think it really drew a lot of people into wanting to provide the procedure. On the surface, it seems like it's something that's easy to do. And I think that's kind of led to some of the issues we're having now.
I mean, I'm a huge fan of fat grafting. I know this got like a bad press for a while because it was dangerous. I mean, I think we've really like we should have refined a lot of these procedures, found some safety data. It's not a perfect operation, but it's getting safer by some of these task force and things we've been doing to make it safer in appropriate hands with appropriate amount of fat grafting, right? But I love
think that's a huge
the concept.
point, Christy. Yeah. Actually, I think that's a huge point, what you just said. Being in Florida, I'm sure you see this in Houston too. I think that, there's a huge difference between the operation as you or I would do it or Jason would do it and the way it's happening at some of these clinics, right? When it's not being done by a board certified plastic surgeon. And I think that that's part of why there are such differences in complication rates between.
I think some of the time it's done by their assistants. I think that some of these clinics, they have doctors from out of the country doing the procedures while the doctor may be in another room. I think there's a lot less hands-on than you would find ethical.
Yeah, there was even one I read about where there was, there's a guy who was trained as a radiologist. This is in Southern California. And as you said, Jason, he was having this guy was a defrocked PA basically. Yeah. And he was leaving him alone to do the liposuction.
No, that happens a lot, especially when you're getting these basement prices, right? Something has got to give, and the way that they're able to do these cheap prices is volume. Yeah. And who's doing that volume is often not times your surgeon. It's their assistant they're getting started and they're moving to the next room and they're running 2, 3, 4 rooms in tandem. And that's just that's a safety concern, no question about it.
You get what you pay for, obviously.
Yeah, and the bottom line is, I think if it's done appropriately by a board certified plastic surgeon with a lot of experience in liposuction surgery and fat grafting procedures, the procedure can be done very safely. It's just, it's not always under those circumstances.
And we learned that we learned that you have to stay superficial. You can't go in the muscle. Don't put too much medially. I mean, put it mostly laterally and upper pole. But I think we learned about the safety areas. But you know what? Every time I approach one of those, I'm always careful, and I'm like always a little scared when I'm doing them. I'm not cavalier with my buttock fat grafting cases.
But that just describes, a central characteristic of a good surgeon, right, Jason?
Yeah.
I mean, I think that anytime you're about to put a knife on another human being's skin, you should be a little scared. You should be respectful, right?
Right.
So, I think that's why you do a good job.
And I think a lot of it is, as we've all been in practice for a while, it's not like our first day. Like, what are we doing today? Let me brush my teeth. It's pretty much the same thing. We do the same similar cases over and over again. That's the mark of a good surgeon, getting good optimal results. But again, I always say with this case, it's one we always approach with a little bit maybe more respect than we might do something else.
Right. I mean, I love the statistic in there talking about the safety that, originally when this came out, a couple years ago, that this was the highest risk of mortality of any procedure we did in plastic surgery. That's scary numbers. I love that it's getting safer and safer and safer because fat's not going anywhere. I love this as an adjunct, still from Peter to pay Paul. We're a fat society. And I love that idea of being able to move that to your breast, to your buttocks, to your hip dips, to all these small area, face, lips. Like there's so many places that back of your hands. There's so many places you can put fat. And so I love that we're being able to harness that safely and appropriately, for sure.
But I'm not getting in Boca, which maybe has a slightly older patient population at times. I'm not getting the cases like from Miami where the young women are looking for supersized butts.
Right.
I'm getting more people looking to recycle their fat or just looking a little bit more shapely. But
sure.
I mean, if they want like crazy size, I usually say go to Miami, one of the clinics. That's what they're better.
But don't you think there's also a correlation between those patients that want like the Volkswagen back there, and the ones that want to get it for a really cheap price?
Yeah.
I mean that's kind of what I see.
I think so.
And it's a little bit of social media driven, right? I mean, you're getting folks that are gravitating certain physicians for their aesthetic. So you're getting certain ones that are gravitating towards the Instagram posts of, these surgeons with these really exaggerated Jessica Rabbit shapes and things like that.
Right.
So I may not be getting, I can give you, stripper boobs if you want stripper boobs. Same things with the big booties. It's just not necessarily my aesthetic.
Right.
And so I tend to get a lot more conservative mommy makeovers for the most part. I mean, we have a huge Latin population.
Yeah.
So, I transfer fat. Every ounce of fat that I take off, I always ask, do you want me to put that anywhere else or do you want me to throw in the trash?
I always say butt, breast, or face. Where do you
there you go.
Right.
Or trash. I give them trash.
And don't forget your hands. Hands are really good as well, too.
Yeah.
But the thing is like, I think the audience needs to realize that when we do put fat grafting into patients, that they're going to lose some of the fat.
Absolutely.
Like you're not really getting all of the take. So kind of like segue into our second kind of portion of this is like we're all seeing a lot of patients. We'll start with the buttock where they're showing on the table fat grafting. Yet, some of these pictures look kind of overblown on the table. And I think the patients need to know that's probably not what you're getting in the long term.
No, I think that buyer beware when it comes to social media. Everybody's going to put their best foot forward. That's exactly what it is. And a lot of these on the table results are so artificial. This is not how your tissue is going to respond. There is minimal to no gravity when you're laying on the table. And so those shapes are unlikely to be the shapes, post-operatively. I think really those 3 to 6 month results are really where your bang for your buck is. And even longer when we talk about different procedures. But certainly the on the table results, I think that people are taking as I want this. Because I get them, we've all had it, I'm sure, where patients come in with an on the table result and this is what I want. And you're like, that's totally artificial. You know what I mean? I don't know, that's not how that's going to look a couple months from now.
And in fact, when we show our before and afters at our meetings, our board society meetings, most of the time they want us to show 1 year results minimum. And when we publish, I review a lot of papers for articles, they always want 1 year photos. The only ones we might take a little earlier are some of the laser photos, which after about a month, you kind of get what you get for some of the lighter ones. But for the both surgical procedures, they all want to see 1 year results. So on the table stuff isn't really relevant.
Yeah,
that's a good point. That's unethical. Yeah, exactly.
Right. Can you imagine what the response would be if you were at the podium at ASAP's, at the American Society for Aesthetic Plastic Surgery, and you showed an on-the-table result with baby oil rubbed all over the butt, and the patient was in a weird position? I mean, it's disingenuous at best, and some of our colleagues have gotten very creative at making the result look even more, attractive
Exaggerated,
or exaggerated. But the reality is that it's going to lead to disappointed patients, So, I don't think that in the long run you're representing the specialty or the procedure, in the best way. I think that being real and being honest with patients is the best way to approach it, and showing clinical photos with an appropriate follow-up, I think, is the best way to go.
Absolutely. I think it's important with these longitudinal photos too. When you go in to see a plastic surgeon, you need to see some clinical photos. I think I'm getting really, we get a lot of people now that are showing, like, patients are showing their own photos. So they'll have a pre-op and then their own photo post-op. Those are not clinical side-by-side comparisons, right? We don't know what these patients are photoshopping and their angles and all those things. So I think side-by-side clinical photos an appropriate time point, not on the table or patient taking their own photos on Instagram and who knows what kind of artificial things they're doing to those. I mean, I think you've got to really be thoughtful about that when patients are looking for surgeons.
So don't trust what you see on Instagram all the time. Maybe sometimes, but not all. Be a little
cautious.
Cautious.
Exactly.
Yeah, I think it's important to be cautious. I mean, I think it's important to be honest with patients in your representations of what can be done, and it's important to set appropriate expectations. And there's a reason that the societies have standards for the way we're supposed to present our photos when we're communicating with each other or presenting them to patients.
And they used to beat on us, right?
Yeah.
As a resident, you got beat on if your photos were if the side photo they turned the head.
That's right. If it was a bad angle, or if they weren't in the Frankfurt position, right?
Yeah.
So, and the reason those standards exist is because that's the only way that you can really make sure that you're comparing apples to apples, right?
Absolutely.
And showing a real result.
And if you go to take your oral boards and you don't have good pictures, you're failed.
Right? Absolutely.
I mean, that's how high we are. Now they're trying to cheat the system afterwards by showing a lot of these on-the-table results. I just think it's not fair. If you want to see any more information, please go to our website at theplasticsurgerychannel.com or go on YouTube and type in, search the Plastic Surgery Channel and look at our videos on YouTube. And for another day, guys, wonderful chatting with you. I'll see you all soon.